The most serious complication of laparoscopic surgery is the inadvertent trocar injury to the blood vessels behind the peritoneum, particularly the inferior vena cava and the inferior mesenteric artery. The consequences of such injuries can range from mild posterior wall hematoma to severe bleeding, shock, and even life-threatening situations. How can we prevent trocar injuries to the posterior wall? A new device called a safety trocar has been introduced. Its unique feature is an automatic protective valve that deploys upon breaching the abdominal wall and entering the abdominal cavity, preventing damage to the viscera or posterior wall. The use of safety trocars is particularly significant for individuals with low body weight, thin abdominal walls, or children. For normal abdominal walls, any type of trocar can be used. Another preventive measure is to maintain adequate intra-abdominal pressure by insufflating carbon dioxide, ensuring sufficient abdominal wall distension. Experience also plays a crucial role. Some hospitals have encountered such accidents, emphasizing the need for increased vigilance. Therefore, it is essential to pay attention and consider individual variations in the abdominal wall when selecting trocars and insertion sites. Once a hematoma forms, close observation is required. In cases of minor injuries involving veins with slow bleeding and minimal overall blood loss, observation alone may be sufficient as the bleeding stops naturally and the posterior wall hematoma resolves. Conservative palliative therapy can also be employed. However, if the posterior wall bleeding rapidly increases and extends to the lower limbs or pelvic wall, it indicates severe bleeding, requiring incision and evacuation of the hematoma. Once the blood vessels are identified, ligation should be performed. In cases of hemorrhagic shock caused by significant bleeding, where the heart rate is elevated and blood pressure drops, prompt incision of the abdominal wall and repair of the injured blood vessels are necessary. Prompt repair of major vascular injuries is crucial to prevent life-threatening consequences. In summary, although laparoscopic surgery is generally safe, there is a 0.1% injury rate associated with trocar insertion. Therefore, it is vital for surgeons to place high importance on these risks and take necessary precautions.